One of the main reasons that I came to this area was specifically to address the need of patients in the Merrimack Valley and obviating the need for them to go into Boston to seek care. While there are excellent facilities in Boston, we have an excellent facility here. One of the things that we look to really growing and having prosper in this community is the upper extremity joint program. And specifically, we're looking to provide the highest quality level of care for joint replacements of the upper extremity, including the shoulder, the elbow, and the wrist. Many of the patients that come in to see me don't require surgery, and so in treating them, the first things that we do are first evaluate the problem, identify exactly what the source of the pathology is. Most of the things that we have to offer revolve around physical therapy, which Lawrence General has to offer as a service. In addition, we use rest, anti-inflammatory medications, sometimes activity modification, and corticosteroid injections, and sometimes pain medications when necessary. When all of those have been attempted over a reasonable time frame, and/or there is some serious pathology that can't be fixed with non-operative means, we consider surgical intervention. The new ORs here in the Sanagati Center really bring the technological and patient care experience up to effectively the state of the art. There really isn't much of a comparison anywhere on this side of the country in the Northeast that compares to the new equipment that's available in the OR. And while the equipment doesn't supplant the people that provide the care, giving the surgeons and the patients the tools to work with that basically keep us at the very top of our game and give the patients the best possible experience and the best possible outcome. For referring physicians, my whole goal of being in this area is to keep patients in the community, to keep patients in the area. Providing the highest level of care available should provide comfort to referring doctors, knowing that their patients don't have to go far. They don't have to go into the city or elsewhere to get specialized treatment. We can provide it right here at Lawrence General Hospital.